Hello and welcome. My name is Maddie Brooks, and I'm a pre-medical student who has been working in healthcare for the last 3 years. I've had the privilege of serving as both a cardiac monitor technician and a patient care technician, and those experiences have given me firsthand understanding of how hospital systems operate, both their strengths and their struggles. My long-term goal is to become a physician specializing in cardiovascular health and research. I'm passionate about understanding the human heart, not just as an organ, but as the center of life and care. Working alongside nurses, physicians, and other healthcare professionals has shown me how powerful teamwork can be when everyone feels supported. But it has also shown me how much strain our healthcare workers, especially physicians, are under. As someone preparing to enter medicine, I've noticed one issue that stands out across every hospital I've worked in: burnout. It's more than exhaustion or frustration. It's something that eats away at motivation, compassion, and even safety. It doesn't just affect the people in the white coats. It affects everyone, including patients. In today's episode, I'm speaking directly to hospital administrators. You are the people who shape the system that either protect physicians or push them past their limits. I want to talk about what burnout really looks like, why it directly impacts patient safety and hospital performance, and most importantly, what can be done to change it. Burnout is not just being tired after a long shift. It's deeper than that. It's emotional exhaustion, detachment from patients, and a loss of purpose in the work itself. It's when a doctor who used to light up explaining a diagnosis starts giving short, mechanical answers. It's when the person who always double-checks every lab result begins to miss small but critical details. Imagine one of your best physicians, the one everyone relies on. They're passionate, thorough, and empathetic. But over time, constant administrative demands, short staffing, and pressure to meet metrics wear them down. They start skipping lunch breaks, staying late, and catching up on documentation long after their shifts end. Eventually, they become emotionally drained. Their care is still competent, but their spark is gone. This doesn't just stay within one person. When a physician burns out, it sends ripples across entire departments. Nurses notice the change in tone, patients sense less empathy, the culture shifts, and morale drops. Research has confirmed what many of us working in healthcare already know. A 2022 DMJ meta-analysis covering more than 239,000 physicians found that burnout doubled the risk of patient safety incidents, reduced professionalism, and increased patient dissatisfaction. Think about what that means for you as administrators. Patient safety scores drop, reputations suffer, and operational efficiency declines. Every part of the hospital is affected. But the data also reveals something interesting. In a 2021 review in BMC Health Services research, found that the connection between burnout and patient safety isn't always direct. In some hospitals, even burned out physicians still maintain strong safety records. What does that tell us? It shows that systems, the policies, support structures, and cultures that administrators oversee can either buffer physicians from burnout or amplify it. When administrators create environments that prioritize rest, efficiency, and emotional well-being, physicians can continue to perform safely even during stressful times. But when those systems break down, the burnout turns into real risk. Burnout is not only a human crisis, it's a financial one. Replacing just one physician could cost hundreds of thousands of dollars in recruitment, onboarding, and lost productivity. According to a 2022 Health Affairs study, burnout has a direct and complex relationship with the cost and quality of care. In other words, hospitals that fail to address burnout often end up paying for it elsewhere, in turnover, lower morale, and decreased performance. And that cost doesn't end with one department. When burnout spreads, it creates a domino effect. Nurses feel unsupported, residents see unhealthy role models, and patients begin losing faith in their care teams. Eventually, even well-performing hospitals see staff shortages, slower recovery times, and weaker patient outcomes. Let's bring this closer to home. Picture a patient, maybe a father recovering from heart surgery. He needs his physician not only to manage his pain, but to notice subtle warning signs that can mean complications. A burned out doctor may still complete their rounds, but their attention might drift. Maybe they rush through the charting, or maybe they become too emotionally spent to ask how the patient is really feeling. That small difference, the absence of attentiveness, can change everything. It might delay a diagnosis or cause the patient to feel unseen. As someone who has worked in patient care, I've seen this dynamic play out. The physicians I've worked with are some of the most dedicated people I know, but I've also seen how exhaustion dulls even the most compassionate professionals. As a pre-medical student who plans to specialize in cardiovascular research, this hits close to home. I want to help patients live longer, healthier lives, but that won't be possible if the physicians who treat them are themselves running on empty. So, what can you as hospital administrators do? The first step is rethinking documentation systems. Ask yourself, how much of your physician's time is spent fighting with technology instead of caring for patients? Many doctors now spend up to half their day inside electronic health record systems, and most of them describe those systems as inefficient, repetitive, and emotionally draining. You can make a change here. Start by bringing physicians into the conversation when selecting or updating documentation tools. They know where the bottlenecks are. Streamline forms, reduce unnecessary clicks, and remove redundant steps. Some hospitals have hired medical scribes who manage documentation during patient encounters, freeing physicians to focus on care. Others use voice recognition software or AI-assisted charting to make documentation faster and more accurate. And don't underestimate the small tweaks. Something as simple as autofilling common lab panels or integrating templates for reoccurring cases can save hours every week. Every hour you give back to a physician is an hour they can spend on meaningful patient interactions. When administrators take this seriously, the effects ripple across departments. Patient satisfaction improves, communication flows more easily, and physicians feel like their expertise is valued, not buried in paperwork. The second step is protecting real time off, time that restores, not time that gets filled with unfinished charts. Too often, physicians leave one long shift only to spend their supposed day off finishing notes or responding to messages. That's not rest, it's invisible overtime. Administrators can change this by creating schedules that make real rest possible. Enforce reasonable shift limits. Encourage that coverage is available so no one feels guilty for taking their vacation days. Some hospitals have implemented structured recovery breaks after periods of intense clinical work, especially for high-stakes fields like surgery or emergency medicine. These measures aren't indulgent. They are about safety and sustainability. Fatigue leads to errors. Studies consistently show that well-rested physicians make fewer mistakes, communicate better with their teams, and have higher patient satisfaction scores. Another key factor is psychological rest, creating a culture where time off is respected. That means eliminating the expectation that physicians must always be reachable or available to pick up extra work. The simple act of encouraging a doctor to fully disconnect can be transformational. As leaders, when you model that balance and show that rest is valued, you empower your teams to protect their own well-being. That is leadership by example. The third and final step is building a supportive culture. Burnout thrives in silence. It grows when physicians feel they can't speak up about the pressures they're under. The most effective way to fight it is through connection and openness. Hospitals that create peer support programs, like Balance groups where physicians share experiences and reflect on challenges, report better morale and lower burnout rates. Confidential counseling services designed specifically for healthcare professionals also make a big difference. But beyond formal programs, administrators shape culture through everyday leadership. When senior leaders openly talk about the realities of stress, when department chairs encourage their teams to seek help yearly, and when wellness is treated as a shared priority rather than an individual problem, it changes everything. Think of it this way. You can't ask physicians to care deeply for others if they believe no one cares for them. A supportive culture restores trust, communication, and teamwork, all of which directly impact patient care. The truth is, physician burnout isn't just a workforce problem. It's a patient safety issue and a financial issue, and most importantly, a leadership issue. And hospital administrators, you, have the power to change it. By improving documentation systems, protecting genuine rest, and creating supportive cultures, you can transform hospitals into environments where physicians don't just survive, they thrive. These steps are not just about wellness incentives, they're about sustaining the heart of healthcare itself. Burnout may never fully disappear. The nature of medicine is demanding, and stress will always be a part of the job. But as administrators in charge of your physicians and your systems, you have the chance to significantly reduce it. Every policy you write, every workflow you improve, and every ounce of compassion you extend to your teams makes a difference. As a pre-medical student working towards a future in cardiovascular medicine, I see this as part of the healing process for healthcare itself. If we can heal the system, we can help physicians rediscover the passion that brought them into medicine. And when that happens, patients benefit most of all. So I'll leave you with this. Creating change starts at the top. Administrators who care about their physicians build hospitals where care is safer, teams are stronger, and the next generation of doctors still believe in this profession. Thank you for joining me for today's episode and for taking the time to listen, reflect, and consider the role you're playing in shaping the future of medicine. I hope this conversation encourages you to take even one small step towards reducing burnout in your organization, because that step could change everything.